Good afternoon. Thank you guys again for joining us on our Facebook Live broadcast that we've been doing this spring and summer. So I'm your host. I'm Dr. Amy Thompson. I'm the CEO of Covenant Children's in Lubbock, Texas. And just want to give a few reminders, and then I'm excited to introduce our guest today. So as a reminder, the information that's provided during this event is for informational purposes only. This event does not create a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. So we're so glad that you decided to join us today. It is my privilege today to introduce to you Dr. Jeremy Dalton. Dr. Dalton is a dear friend, a colleague, and I'm so happy that he is here with us in Lubbock. And so I have asked him to come and talk with us today about all things. We're going to talk about child care and immunizations and all of these great things. So Dr. Dalton, thank you so much for joining us. And why don't you just start by telling just a little bit about yourself and what your role is here in Lubbock and what all you do.
My pleasure, Dr. Thompson. So I've been in Lubbock for since about 2008. I grew up here and then went off to medical school in Houston for a while, and then my wife and I moved back a few years ago. I'm a pediatrician with our medical group here, and been doing that since 2008. My wife and I have a practice together, and we also have 6 kids of our own. So we have a lot of kids at work and a lot of kids at home. So we at least have a lot of street cred, I think. And so I've also been pretty active in the hospital, on the hospital medical staff. I've been chief of staff and served in a few other roles as well. So my pleasure for joining us.
I'm so glad you're joining us. And he really does have a lot of kids. And so we joke that their office is a popular one here in Lubbock. So people just talk about going to the Daltons, and it's fantastic. So obviously, almost everything that we're talking about these days has to do with COVID. And so I just want to talk specifically about routine child appointments. And so when kids come in just to get that routine care, have you seen a change in that? And, kind of what are your thoughts on those differences that COVID has hit?
Yes, we definitely saw a change. I think when COVID hit back in the spring, really a lot of pediatricians and physicians in general were kind of just sitting around not doing much of anything because people were under stay-at-home orders, and everyone had quite a bit of anxiety about getting out. So routine child care definitely suffered, and it's starting to pick back up, but I think there was a lot of ground to make up. And not only did we notice that in our practice and in our community, but there was definitely a noticeable drop nationwide in routine child care and immunizations.
Yep, I agree. And so specifically, I want to just ask a question about immunizations. Did you also, with that routine child care, obviously that's normally when kids will also get immunizations. And so have you seen that in your practice as well?
Yes, we're playing catch up on the immunization front right now, because when people don't come in for child care, they don't come in for routine immunizations either. So, and as anybody with kids knows, kids get a lot of vaccines from birth until about 2 or so. So if they miss a child appointment, they're going to miss shots too. So you can't make those up in one visit often. So it takes a little bit of time to make those up if they miss appointments.
Yeah, I agree. And so talk a little bit, I think sometimes when we have people watching, talk a little bit about like what I would call an essential doctor, visit. Sometimes, folks will talk to me even, I just work here in the hospital, but I have to remind patients also, all the time that we have to follow up with our PCP, not just when we're sick, but for these child exams and for immunization. So talk about those as, essential doctor visits and kind of what you're hoping to accomplish in those visits.
Yes, that's a good question, Amy. There's a lot packed into these visits. So, people think about just sick visits as a time to go to the doctor, but child visits are really important too. So not only do we give vaccines at well-child visits at certain increments, but there's a lot of things we look at as well. So, we plot kids out on the growth chart. We see how they're growing. We do a very thorough developmental assessment every time they come in, and a comprehensive physical exam too. We do things like check their hearing, check their vision. And sometimes parents don't exactly know everything that's going on because they're busy too. So it's really our job as pediatricians to make sure kids are completely healthy, both physically and emotionally at well-child visits.
Yeah, I agree. And, when we were in residency, I joke that was the last time I did clinic was, in the residency days. But one of my favorite parts of those visits was, we called it the anticipatory guidance, section that you would look at each of those well-child visits. And, it was an opportunity for you to answer questions from moms and, exactly how to anticipate the guidance that they're going to need kind of for that next, developmental stage. And I often found that it was a great time to talk with the parents about, what to expect, and clearly, what to look for if they didn't see some of those, anticipated things.
Mm-hmm. Yeah, we can always, like you said, we can make sure things are going well during that visit at that time, but also tell them what to anticipate from that visit to the next one, because there's oftentimes 2 to 3 months between visits. Yeah. So they need to know what to expect over the next several months.
And it's been my experience, I work in the hospital. So obviously, you and I work together where you guys will sometimes send kids to us. And there have been kids that we have picked up because they've come to well-child visits that say, like you talked about, that have fallen off the growth chart or, various other things. We're actually able to bring into the hospital and kind of figure out, what's going on with them. And maybe even in a way that the parents were unaware that they had, fallen off the curve or, different things like that. So I know we work very closely with you guys in the outpatient setting to be able to identify kids that we need to do more workup for in the hospital.
Yeah.
So talk specifically about, when parents, I will often, get this question of like, what immunizations are the most important, and, why are they the most important, and what would you consider? Now, I'm going to be a big pediatrician and say, they're all important. And so, yeah, I'm going to say, so you don't get out of this by giving what I know is your answer, which is all important. So
yes, okay. I have this conversation a lot, and I talk about which vaccines are most important, if not every day, multiple times a week. And I do think they're all important, and I'll talk about that more in a second. But I think the most important ones are the ones that for illnesses that are still present in the community. So you can think about like whooping cough and tetanus. You could get, if a child's not vaccinated, they could get that at any point because pertussis, which causes whooping cough, and tetanus are still alive and well. And also, I think that is probably the most important one, especially in infants, because if they got whooping cough, they could get very, very sick, and they could come see you in the hospital very quickly and be there for a while. But then there's also other vaccines. We vaccinate against a bacteria called strep pneumococcus that causes a lot of different problems. It can cause something as simple as an ear infection, but also it can cause pneumonia and bloodstream infections and meningitis, things that are really bad. So that's a bacteria that is present in the community. We have a vaccine now that covers 13 strains of this bacteria. So it's very effective at preventing a lot of illnesses that were not able to be prevented in the past. So I think those are the two that come to mind. Also, I think there are vaccines against meningitis. So especially kids that are going to middle school and college need those. I think it's especially important for college-age kids because they're going to be going to a dorm and being in close contact with many other college-age kids. So meningitis it can spread very easily amongst college-age kids who are close together. So there are illnesses like that are still alive and well in the community, but it's important to vaccinate against other things as well. Because you think about something like polio. So you're like, well, I don't need a polio vaccine anymore because it's been gone for a long time. And that is true, although in places where vaccine rates are lower, polio still exists. So I always tell patients, polio, if you're not vaccinated, polio is just a plane ride away. And so we need to get vaccinated against that just to keep our vaccination rates up, so herd immunity is present. So I'm sure everybody's heard lots about herd immunity with COVID, but herd immunity is important for other things as well. So there's also another bacteria called Haemophilus influenza. So that vaccine came around in the 80s when Haemophilus influenza was causing meningitis in lots of different kids, and it was a very, very debilitating disease. But the vaccine works so well, we don't ever see it. I've only seen it once or twice in the last 15 years because the vaccine works so well. So that's one that you should also get, even though we don't see it anymore, because it's important to keep vaccination rates up so we can continue to have herd immunity against these illnesses. So, and then also you take something like the flu vaccine. I think that one is really important as well, because even though the flu vaccine is not 100% effective, it is one that is important to prevent complications from seasonal influenza that can affect anybody, but especially young kids and older people. And there's also, even if the vaccine isn't a perfect match to the strain from year to year, there's still some cross immunity to different strains of the virus.
Yeah,
one other I might mention is the MMR vaccine. I think that one's really important.
You're mentioning all of them, Jeremy.
I know, because they're all important, Amy. And the MMR is important because there's still outbreaks of measles here and there, and we were just getting over a measles outbreak whenever COVID came along. We're not hearing much about that, but I am concerned, just like a lot of pediatricians, that as vaccination rates dip, something like measles can surface again. So it's really important to vaccinate against everything. So again, I know that may not be what you're looking for, because we wanted to talk about the most important ones, but I think they're all important.
I agree. I always laugh at this question because I think that if you have to make a list, about what the most important are, I think you've done a great job with that. But it is really true that I joke, this is the joke amongst, pediatricians, is the real correct answer is they're all important. And I obviously have this, biased, patient population that I see, because since I just work in the hospital, we oftentimes only see the kids that are very sick from, vaccine preventable illnesses. And I will say that I'm older than you. And so I started at a time when there was a lot of the diseases that we had actually, in many cases, we were using the term eradicated because of those high herd immunity rates and, those different things. And we certainly have seen those have a comeback in the last few years with increasing immunization rates. And so I always have to, when people ask me the question about, vaccines and immunizations, I always have to lead with, you have to keep in mind, all of the kids I see are the kids that have had very bad outcomes from diseases. And so, we talk about strep pneumo, and for me, as a pediatric hospitalist, what strep pneumo means is usually very devastating meningitis, and who leave not neurologically the same, as they came in. And so, I never want to use scare tactics or things like that. It's more that this is the reality, is that when we allow these things to come back in. And then I also, in the hospital, I have the privilege to take care of a lot of cancer patients. And so patients who are immunocompromised and, those folks. And man, it is really important that we all as a community, like even on things like flu, I believe in getting flu because it is the flu in the general population. But the simple flu can be a deadly disease for a kid with cancer. And so my perspective is very much, I think sometimes it's skewed because I can see the downsides, of what happens when we don't do these. So we do have a question that's coming in, and I actually think while we're on this topic of this, I'm gonna ask this question about some of the adverse things that happen with immunizations. And so this is specifically the risk of febrile seizures, and we've seen that these are seizures that just happen with fever for those of you who are watching. And the question is there a risk of febrile seizures with any of the childhood vaccines? And my brother had a bad experience many years ago after a vaccine. And so talk a little bit about what you know, and then I'll chime in as well.
So I think the one that they're probably had the adverse reaction to is probably the DTP vaccine. So I think one of the good things that we've done with vaccines in the last few years is we've substituted the pertussis component with an acellular component, so the side effects are much more mild. So whereas the old one there was a risk for febrile seizures, the new one, they can have some low-grade fever, but that's really the most common side effect. They may get a little bit fussy, but the downside to substituting the pertussis component with an acellular component is it doesn't work quite as well as the old DTP vaccine, but side effect profile is much better. So I think what I always tell patients is the main side effects to vaccines, the ones that they need to be aware of, is a low-grade fever, fussiness, and they may be a little bit sleepy, but that usually happens with the 2-month vaccines. The 4-month vaccines, they tend to get a little bit more fussy and run a little bit more fever. 6 months are usually better. After that, I think the risk of side effects is pretty low. I think with the MMR vaccine, that's the one they get at 12 months. They can get a rash a few weeks later, but that's really fairly uncommon. I think uncommon side effects would include a high fever, more than 102. Does not happen very often, but it can happen occasionally. I think anytime you have a fever that high, it can lower the fever threshold a little bit, and febrile seizures could be a side effect, but that is a very rare side effect, and nothing I think that parents should be too concerned about. They can always, of course, treat fever and other systemic symptoms with Tylenol or Motrin. That can help. And then I don't think that a very small risk of adverse side effects should prohibit parents from giving vaccines to their children.
Yeah, I agree with that. And I actually have this theory. Who knows, if the theory is correct. But I think that because we had done so well in the past with, immunizing, and we had, in many of these cases, we had really eradicated a lot of the disease, that the thing you hear about now, because you don't hear about the side effects of those diseases, is you hear about the side effects from the vaccines, which, to your point, many times are mild, but are very scary. And I will say, not in relation to immunizations, but as a pediatric hospitalist, I take care of a lot of kids with what we call febrile seizures. And while it is not scary to me, I think because we have, taken care of it for so much, I can fathom, I'm a mom. And so I can only imagine that sometimes the things that I hear myself saying to my patients, I'm like, these people must think I'm crazy, when I'm like, hey, we see this and it's going to be fine. And it's really scary. But the kids do really well with this. And I think sometimes it's that fear of, these adverse events. And I think sometimes what has happened is, because we have gotten close to eradicating these diseases, we see more of conversation about the adverse events than actually about the diseases themselves. And, the truth is, I also think, I think about, there was a Brady Bunch. You're probably even too young to watch Brady Bunch.
I watched the Brady Bunch.
There was a Brady Bunch. I think that they had the mumps. Do you remember this? And
yes,
mumps or, something, and they were in the house. But I also think that sometimes that's how we think of those diseases. Don't think about is when mumps was a thing, even when the Brady Bunch was on, there was kids every year who, lots of kids who died from those types of diseases. And so, sometimes I think we have this view of these diseases, that's very, I'll call it very Brady Bunch, that But I think sometimes the reason that this can be scary for parents is because they're reading more about the, adverse effects of vaccines rather than the things that can happen if we allow these things like to come back into our, into our community.
Yeah. Yes. Yeah. I think those are very good points.
Yeah. Okay. So I'm going to go to kids coming in for well child visit. What are specific things that you guys have done in your clinic that are like safeguards and that can help parents, feel safe about bringing kids in for well, care and those kind of things?
Yeah. Luckily, we had plenty of time to sit around and brainstorm in the spring while we weren't seeing patients about how we could protect them when they came in. So we're doing a few things. So we basically have eliminated our waiting room. So that's probably been the most helpful things. The patients really aren't in contact with other patients. So we've had them wait in their cars, and then we just we usher them from their car to an exam room and then back out, so they don't have to sit in the lobby with other potentially sick kids. We've also separated well visits from sick visits. So we've been clustering well visits together and sick visits. So I think keeping well kids in one part of the schedule and then sick patients on another has really helped as well.
Okay, good. Those are great things, and I encourage you, if your, pediatrician's office is not doing those things, encourage them to do safe practices. There's really good things that are out now on ways that you can make people feel safe, and we've had the same thing in the hospital.
And then, of course, mask usage too. Everybody's pretty well used to mask at this point, I think, but everyone's required to wear a mask, so I think that's been helpful as well.
Yeah, I agree with that. So I have had some questions on things like, okay, so are you saying that like if I miss a routine, visit for my kid or something like that, does that increase the risk that my kid could potentially get COVID? Or is the reason that you're telling me to come in, a different reason than just because of susceptibility to COVID?
Yeah, I think that's a good question. I think it totally could potentially increase the risk for COVID. I mean, I think thankfully, something I've been really happy with. I mean, most pediatricians have kids seem to be not as affected as severely as other segments of the population. But I think it's important to come in for well visits just to make sure that your child is healthy, growing well, and there's no underlying conditions that we could potentially pick up in a well visit that could make your child more susceptible to complications from COVID. Another thing, if say if you missed a routine immunization visit, like the 12-month visit, say, where they get the Mmr vaccine, if they miss the Mmr vaccine and then they're exposed to somebody with measles, then if they got measles is one of the reasons measles is such a terrible illness is because it pretty much erases your immune memory. So you would not have as many immune cells to fight the coronavirus if you did get it. So I know that's kind of extrapolating quite a bit, but that is one example of a reason it would be good to stay as caught up on your well child care as possible.
And I'm always amazed, every pediatrician, especially, I don't know what you do for your kids since you actually are in the clinic, but every pediatrician has to have a pediatrician. And so
yes.
I have been with the great Dr. Holly Hansen since she was one of my residency. She actually was a teacher for me in residency. And I will have to say that one of the things I'm always amazed about is stuff that I have told my children 750 times, and that they roll their eyes. They go to Dr. Hansen, and she says it one time, and we will get back in the car, and they're like, "Did you know?" Do whatever. And I don't want to run past that, because I really do think that we have to remember that pediatricians have that relationship with people's children. And it has been amazing to me over the years to watch when a pediatrician tells my kid something, they actually listen. Maybe I should go do some research on that, but they actually listen, and it really makes a difference. And so I would expect say, if you have a kid who is, in a higher risk group for having, some adverse, effects from COVID, if you have asthma, if you have underlying, lung, issues. Part of the reason we also want you to come in is because Dr. Dalton will talk to your kid and be able to say some things to them about making sure that they understand how to protect themselves against COVID. And it's just that our kids sometimes listen to other people before they're going to listen to us. And I don't want to run past. I've watched it even with you when you come to see patients, with me in the hospital, is that these kids and their parents really trust their primary care doctor. And so I think that the primary care doctor can have a real input into helping those kids make good decisions.
Mm-hmm. Yes, that's an excellent point. A lot of times it just takes somebody, not the parent, to tell them. And I think it helps if you have a medical degree and a relationship with the patient. So that's an excellent point, Amy.
Okay. And so talk just really quick about, if we have somebody who's watching and they are struggling, with resources and different things like that, are there places that folks can go for vaccines at, low cost or no cost? And where would you encourage those folks to go if they're worried about being able to, afford a copay at a PCP's office or something like that?
Yeah, I think they have a couple of different options. First of all, they could always check with their primary care physician, because we all, as far as I know, have VFC vaccines, which is vaccines for children. I think that the VFC vaccinates, I think, about 50% of the kids in America. So that would probably be the first thing. Those are inexpensive. I think they are $5 a vaccine, so pretty reasonable. The health department's also an option. They do vaccines every day, so they'd be happy to help out. And then we have a children's clinic here that can see kids with limited or no funding. So and that's the case in most communities, I think. So there's a few options, I think. Especially during this time when so many people are struggling with funds just because of increased unemployment and prolonged unemployment. I don't think that shouldn't necessarily, hopefully it won't be prohibitive to getting up-to-date vaccines.
Yes, I agree. And always in your community, I think calling the health department is usually the keeper of resources in terms of they will know a place to tell you that's a low cost clinic or, where you can go for immunization. So I always say they are the keepers of many good pieces of information, about medicine. All right. So this is your moment, Dr. Dalton. You're going to have one last opportunity to say anything that you want to say to our viewers about the importance of well child care immunization. So hit them with.
Please, if you haven't come in in a while for well child care, now is the time, because there's a lot of grace here, because I think a lot of us had anxiety around COVID and fear of exposing your child to COVID, understandably, because nobody wanted unnecessary exposure. So in the spring, I think a lot of people got behind on well child care, but now that schools are starting back up, I think most schools are in session already. A lot of kids are about to go to school. I know that New York City is getting ready to start after Labor Day. I think a lot of other schools are starting after Labor Day. Most kids are going in person, so they're going to be exposed anyway. So, and I think a lot of doctors' offices are doing taking precautions like we've talked about. So I think the risk of picking up COVID at your doctor's office is low. So I think that if you haven't come in for well child care, or you've gotten behind on vaccines, now would be a great time to get that started, because every pediatrician that I know of knows about catch-up vaccine schedules. So if you've gotten behind, don't worry about trying to sort through it. That's our job, so we can help them get back on track. And they haven't really missed that much time. It's only been about 6 months. So we can get every kid caught up very easily. And now would be a great time to do it, because if you're going to get a flu vaccine. I think September is a great month to do it. So, and I think now would be a very good year to get a flu shot, because if we can eliminate one illness this year, I think that would be excellent. And the flu vaccine is a good way to do that. So that's what I would say as far as catching up goes.
Beautiful. I echo all of that. And I would just underscore, we have taken a lot of precautions at the hospital. I know you guys have in clinics to make sure that your child is safe from COVID when they come visit us, but don't delay medical care. That's been my biggest message to people is, if you think your child is sick, bring them in to be seen. And for sure, parents, keep up with well child care and immunizations. And I always feel like I should wear a t-shirt that says immunize, immunize, immunize. So on the ones that we know and are on the immunization schedule, I'm a big believer. Dr. Dalton, thank you so much. It was fun to have you.
Thank you, Dr. Thompson. It was nice talking with you.
Awesome. Well, to learn more about our initiatives, programs, services, or any ways that for medical advice, please visit providence.org and make sure to follow us on social media. And you can look for Providence Health System on LinkedIn, Facebook, Instagram, Twitter, any other thing that you do for social media. So thank you guys so much for joining us. And Dr. Dalton, have a blessed day.
Thank you. You too, Amy. Thank you.